Can I help you?
Well, I'm not quite sure. What exactly is this place?
It's a pharmacy.
Pharmacy. How fascinating. Okay, so here's the thing. I knew that we shouldn't have been messing with the hypersonic phaser. I know that. But all my friends were calling me a wuss. We just kind of went for it. And of course, we had to make bets, and of course, I had to lose. And so we had to pick a random planet and just hop in. Here I am. Now, your planet doesn't seem all that terrible. However, what is terrible is this headache that I've got. You wouldn't happen to have a cure for that, would you?
We have NSAIDs. But you need to be careful with them. I don't know what you've been drinking or whatever, but these are very powerful.
NSAIDs. Yes. What exactly are NSAIDs?
I think we probably should ask ADAL.
NSAIDs is a group of drugs, and NSAID stands for non-steroidal anti-inflammatory drug. So there's a wide variety of these drugs, including Advil, Aleve, Motrin, ibuprofen, Celebrex, a variety. And their major goal, as most physicians use them, is to reduce pain, but it really helps to understand how they work, because some of the drugs have had some adverse effects. In fact, one of them, Celebrex, has been shown to actually produce heart problems with people. So when damage is done inside the body and cells break up, they begin by releasing something called arachidonic acid. And there's a series of enzymes that actually break that down called cyclooxygenases. But there's more than one type, or they're abbreviated COX or COX-1 and COX-2. And the goal of these enzymes is to then produce prostaglandins, which are hormonal chemicals that your body makes in an effort to deal with damage to the body. Many times this causes swelling or inflammation in the body. And when that swelling or inflammation occurs next to a nerve, it presses on the nerve, and that causes the nerve to have pain. So these drugs are useful for pain because they may decrease the inflammation or swelling. Every medicine that we use has a potential side effect, and frequently people ask about what they can use as prophylaxis or prevention of a problem, particularly with SARS-CoV-2 and COVID-19 these days. And I always tell people you shouldn't be taking drugs to prevent something from happening, because in the absence of actually having anything that you can look for, you don't know whether a drug is helping you, hurting you, or having no effect. And with no symptoms and nothing to measure, you can't tell. And so one of the problems that we see with every one of these non-steroidal anti-inflammatory drugs, or NSAIDs, is that they can also have potential problems with bleeding from the stomach. They can interfere with your kidney function and damage your kidneys. As we know with Celebrex, they can actually produce problems with blood clotting and narrowing of the blood vessels, so it decreases blood flow, including to things like the heart. So any of these medicines taken in conjunction with other drugs can have an adverse effect on you. Many times doctors will tell their patients, if you have stomach problems and you're taking aspirin or something else, to take other foods with that, because that kind of helps protect and coat the stomach a little bit. Most of these drugs actually come in a variety of forms. So if you see extended release or long acting, those tend to be released slower into your bloodstream, so they don't tend to get digested in the stomach, so they don't tend to produce stomach problems. You also have to remember, however, that if you take and use some of these foods, for example, milk products, it may interfere so much with the absorption of the medicine that you don't get the effect of the medicine. So it's always a two-edged sword to consider.